Shepherd dog, presenting today for scuffing in all four limbs, according to owner.
So questions here are going to be, is it ortho versus neuro? Is it just the rear limbs, or is it all four limbs? Because that really affects our thought process. If it's all four limbs, that sounds more like a cervical spinal cord problem or a peripheral nerve problem. If it's just the rear limbs, we worry more about a back problem. So it'll be a surprise. Hello, how are you? Dr. Wong, Michael, nice to meet you.
Nice to meet you.
What do you think, Gunnar? 5 years old, and in May we noticed that he was kind of limping. Was he limping in a back leg or a front leg?
He was limping in the back leg because the TPLO had occurred. He had ruptured, and we weren't sure. We thought the limping was just associated with the TPLO.
So
He's not limping anymore.
Had he had the TPLO, or that's what
Yes.
So he had a TPLO. And
Yes, he had the surgery done, everything. But the surgeons,
I'm
surgeon
sorry.
at the
When it
time-
all started, when he started limping, that's what caused you to go
Yes.
get the TPLO. Got
Yes.
it. Okay.
Yes.
And it was just a rear limb there. He was holding it up, or just when he was walking, he was walking.
Very gingerly.
Okay. And at the time that they noticed the limping and the knee problem, were we also scuffing at that time?
He had he had some nail scuffing.
Yeah, I see.
Yes.
He's worn his nails there.
Yes. So in the rear. So what they said was, it could be because of the TPLO that he is scuffing in the nails,
Okay.
or it could be something else.
Sure.
So until they did the surgery, we didn't know.
Okay.
So he had his final orthopedic visit this morning.
Okay.
He's cleared orthopedic wise. He's okay. He's intact. Everything. But I kept noticing that his scuffing was still there. And he's a little bit more gingerly. Like it takes him a little to get going. Is
about,
what
like,
we did notice.
Jumping into the car or jumping onto the sofa?
Nope, he doesn't want to jump in the car anymore.
And is that
Recent.
so? Was that before the
No.
TPLO? So up
After.
until the TPLO and then after. Okay.
Yes.
I would think
He's been licking his paws a lot lately. That's the only other thing that
all
I've
four, or
noticed.
just the rear ones?
No, all four.
Okay.
So I was gonna put the apple cider vinegar or vinegar cider or something like that. I do, at times when I relapse, I use them on my left side, and I do press down right and like around the shoulder blades.
Okay.
So I used to do that. I haven't really done it since the surgery. And I do notice that now when I start kind of leaning on him a little bit, he's just kind of not wanting to do it.
Okay. But he's not overtly painful. He's not like wincing. You can
Nope,
just.
he's not.
Hey, dude. I see things like scuffing of the toes, and not that he was doing it outside, but lots of the things you're describing where, his kind of rear limbs give out when he's chasing the ducks, difficulty jumping up, scuffing of the toes. Those are all things that are suggestive of a neurological problem. When he walks, it's not obvious, but I do think there's enough in his history and on his physical exam findings to justify talking about neurological disease. And I'm kind of in the exact same dilemma that the orthopedic doctors were in, with them saying, well, he has a knee problem, could he also have a neuro problem? I'm kind of the opposite. I think he might have a neuro problem, but it's harder for me to tell because he also has a knee problem that we know about.
Right.
So what are the things that can affect the back or the spinal cord of the lower back? The most common thing that we see is a slipped disc. Dogs can get slipped discs in their what we call L4 to S3 spine. That can cause things like pain. He does seem uncomfortable when I kind of push from the sides and when I extend his hips. whether that's because his hips hurt or whether it's because as I extend the hip back, it flexes or extends the back.
Yeah, he tends to be a little bit more guarded, now that you said that, there. He doesn't want to rough play anymore with my husband anymore. And whenever he gets touched there, he's more like
Kinda
growly
sensitive,
and
yeah.
kind of winches or something. Why?
So, that's one thing would be a slipped disc. Sometimes dogs get instability, so there is normally movement in the last joint of the back, but sometimes there's excessive movement, and that can, when dogs are jumping up or when they are running around, it kind of acts like a scissor and can pinch off the nerves. So that could be one thing that we see in dogs his age and breed. Less common things are things like infection, things like tumors, things like meningitis, things that I think are less likely, but just need to be on our worry list. So
Okay.
I think it's reasonable to do an MRI of his back to look for underlying causes such as instability, slipped disc,
Yeah.
infection, meningitis, tumor, etc. I do think we have enough based off of his history and his symptoms to say it is, medically appropriate to do that. So to me, that's step one, is we do an MRI of his back to find out, is there a physical structural problem in his back to account for the signs, and then based off of that, we can come up with a plan on how do we treat it. All right, if you just right up
No, with him.
here on the left there, Kylie will take
Yes.
care of you, okay?
Well, thank you so
All right,
much.
talk to you soon,
Good to
okay?
meet you again.
Likewise. All right, big man, let's go. Who's back here? Yeah, he's super nice. He's big and strong. There you go.
No, she had. Oh, just kidding.
Lucia, yeah. She had 2 seizures.
So she was seizure free for 2 years. You saw her in July because she had a seizure
Yep.
early July. She was great until September 5th, where they saw the tail end of it. And then from September 5th to last night, she had another one. So mom's just saying there's all of a sudden increase from 2 years seizure free, and now it's been 2 weeks since her last one. The one yesterday was generalized. It was around 6 p.m. She says normally her seizures historically were in the middle of the night, and now they've become like a day thing. And her post-ictal phase, which is normally disoriented and just confused, this one was excited. So it just changed a little bit. Kept her 500 milligrams, 1 tablet every 8 hours. The only change is a diet change recently with she cooks meals at home. They went from chicken to beef.
Hi, good morning, this is Dr. Fitz. How are you?
Hello.
Hi.
How's it going? Great to see you. Hi, Mama.
Say hi.
You're all by yourself today. Where's your companion?
It's just as challenging as
One's just as tough as 4.
because I couldn't separate him. I had to get one of my newest one wouldn't leave. He saw me put her leash and stuff in my
Right.
bag. He wouldn't. He wouldn't
He
leave
put
my
his
bag.
brakes on.
He wouldn't move.
He's kind of.
And even treats would not entice him. I was like, and he's very treat oriented.
Sometimes it's nice to be the only child for the day, huh?
Yeah. Yeah. So she's, as you heard, she's having more frequent
Yeah.
seizures.
Good girl.
And the only thing I think that's changed major is we changed the diet from chicken to beef. That was it. I don't know if that would cause anything.
Probably not. All right. I mean, as expected, her exam's still very, very normal. I don't think it has anything to do with the diet change. If she's doing well on that diet, I wouldn't switch back or anything like that. She's at a lowish dose of the Keppra. It was the dose that she did so well for so long, there wasn't really a need to try and increase it. But she's still she's actually even below the starting dose. I bet when she started, her body weight was here, so it was a 20 mg per kg dose. Her body weight's just here, so we've got room to increase the Keppra, and I think that's what we should do. I think we should go to 1.5 tablets 3 times a day.
Okay, so you're basically giving her another 500, 750.
750 extra per day. Yep. So. Okay.
So I gave her one today, so I'll give her 1.5 at like 4 or 5 o'clock. She gets a burger or a hot dog. At 4 or 5, they all do, 4 or 5 o'clock. And then I'll give her another 1.5. So she'll have just the one. You also want me to give her another half when I get home?
And you can start it right when you get home, yeah.
And then give her 1.5 around 4.
1.5 in the afternoon, 1.5 in the. Yep, and we'll still keep our recheck appointment for presumably, I guess that would be January.
Yeah, but if she has more seizures,
If something isn't going right, give us a call.
Alright, sounds good. Thank you.
All right, great seeing you.
Thanks. Okay,
Oops.
Dr. Ken.
Thank you.
Alright, thanks for everything. Appreciate it.
It's harder with no Dr. Adams and no Dr. DeVita. They're kind of fun days for me because it proves to me that I still can keep up and write all of my records and call all of my vets. But I certainly like having them around for. Gunner's a 5-year-old German Shepherd that presented to us for scuffing of the rear limbs and seeming uncomfortable around his hips or his lower back. He had TPLO surgery a couple months back and improved, but had not fully resolved. So the surgeon was concerned that maybe there was also a neurological problem in addition to the orthopedic. Quite frankly, when I met Gunnar, I was suspicious that we were going to find something like a lumbosacral intervertebral disc or lumbosacral stenosis or instability. It's just relatively common in the breed, and just with these subtle signs of subtle scuffing of the toes, and not being as active, and one time when chasing the ducks kind of giving out in the rear limbs. I thought that's what we were going to find. We did not find that, so we did an MRI today, and quite frankly everything was normal. So fantastic news. No slipped disc, no tumor, no infection. We did a spinal tap, no meningitis, no spinal cord stroke, no instability, no stenosis, anything like that. So sometimes, we don't necessarily give someone an answer. We kind of give them a list of things that it's not, and I think we did something good today for Gunnar, and Mom was very, very appreciative. Is we ruled out a bunch of worrisome stuff. I'm certain there's no slip disc. I'm certain there's no gross or large visible tumor. There's no evidence of meningitis. There's no evidence of infection. There's no evidence of instability or abnormal growth or etc. So the plan for him right now is to continue. So we're going to start some physical therapy for him. He's going to meet with physical therapy on Sunday. Regardless, I think it will benefit his knee post-surgery, and also just he did have some tightness through his hips. He was kind of painful when I extended his hips, so I think it will help with that as well.
So we have Frankie, our 5-year-old male neutered French Bulldog, in room 2. He's presenting today for ambulatory paraparesis. Owners state that for the past 6 months they've noticed pelvic limb weakness, a little bit of crossing over. This has not gotten worse. It's stayed about the same.
Oh, you're coming in? Okay. Whole crew's going in?
We are.
Okay. He's a total man.
Nice to meet you. What's up, big man?
It's Frank the Tank.
What's up, huh? You're solid. Hi, bud. Hi, bud. The other French we saw today had a spot right at the base of his tail, too.
Really? Aw.
Oh, boy.
I love this spot.
Yeah. So Frankie's 5 years old, and for about 6 months we've been kind of weak and wobbly in the rear limbs. He's obviously able to walk.
Yeah.
Do you see him crisscross, or it's just more kind of that sliding out that he's doing there? And
More sliding, and like one leg will go back and like kind of just stay.
Yeah, it happens a lot on any smooth flooring, of course,
Yeah.
but way more than it ever did.
Okay. And it obviously doesn't seem to bother him. He's not acting painful or anything like that.
We have a smaller one too. They play a lot.
Yeah.
And
But it certainly doesn't look like he's slowing himself down or anything like that.
Just up steps. Usually it takes a little bit longer to step up, but that's really it.
we had a pool in Orlando. I think it has something to do with that. So we had this swimming pool with like a very shallow shelf that he used to love to jump in, like when we were in it, and jump out. So he did like a lot of running around, and I don't know if there was like a traumatic event, but he, I think he definitely got worn out one day, and he was lifting around. Remember?
Yeah, Dennis thought he might have like torn a muscle or something, and then
Yeah,
I kept an eye on him, and then it just kind of never went away. Never got better.
And you said limping around and.
Yeah, but I couldn't tell if it was from the pads of his feet, like maybe he had overdone it from like actually like jumping in and out of the pool because it's got the rough diamond bright surface, or if he like done something like soft tissue that we just couldn't see.
So well, I guess when you say limping around, like he was hobbling,
Yeah,
like,
yeah, he'd be
like he had a stone in his shoe type
Yeah,
thing, or
yeah,
okay.
exactly.
Rear limbs, they kind of
Yeah.
circumduct. At times it does that where it slides out on the side. I mean, you can hear kind of a shuffling to it. It's relatively, let's say, mild, but compared to some dogs that we see where they're dragging the limbs. When I flip his feet over, he replaces them pretty quickly. So many times when it's a neurological reason for walking incoordinated or walking being weak and slipping out, when I flip the feet over, they don't replace. But sometimes if it's lower in the back, I don't necessarily see that. So again, it does not rule out a neurological problem, but kind of one of the big things that I look for to say that this is a neurological reason for an abnormal walk. I don't have that piece of the puzzle for you. Kind of when a dog's having a hard time walking, the first question I'm trying to answer, is this a neurological reason for walking funny, or is it bad knees or bad hips or bad muscles or a bad heart? So so when I'm watching him walk, it certainly looks like a neurological reason, just when we have the legs sliding out and crisscrossing and going like this. So when I watch him walk, it's supportive of a neurological reason. One of the things that I do to further say, is it a neurological problem or not, is we flip the feet over, and usually when it's a neurological problem, they just stay like that. It's a pretty good indicator for it being a neurological problem. Like dogs with bad knees, if I flip their feet over, they replace them really quickly, where dogs with really bad spinal cord problems, I flip the foot over and it stays. So he's not giving me that piece of information to help me even better say that it's a neurological reason. But based on his gait, I suspect a neurological reason. What are the possible neurological reasons for walking like this? Frenchies kind of get anything. They get slipped discs. A slipped disc, so his back is made up of multiple bones, and in between each bone is a disc that acts kind of like a cushion or a shock absorber. And we use a jelly donut analogy, so it's kind of built like a donut. There's an outside part and an inside jelly part, and that acts as our cushioner. And in some dogs, what happens is the inside part of the jelly donut squishes out and presses on the spinal cord, and that can cause signs of weakness, incoordination. But most of the time in Frenchies, it's painful. Well, in most dogs it's painful. Frenchies usually don't do a good job of showing pain. They're usually pretty vocal about it. So, and I agree, I don't get the sense that he's painful at all. So slip disc is one cause. It's a common cause. Based on his age and breed, it needs to be on our list, but it does not fit perfectly. Frenchies will also get malformations of their spinal cord, fluid-filled pockets on the outside of the spinal cord, fluid pockets on the inside of the spinal cord. Sometimes those can come on slowly. They're usually progressive. Excuse me. They're usually progressive. They're not always painful, so that's certainly something that needs to be on our worry list. They can get other malformations of stenosis or the bones pressing on the spinal cord. Frenchies get tumors even at a young age, so that needs to be on our worry list. Frenchies get meningitis or myelitis, means inflammation of the spinal cord. So that needs to be on our worry list. Usually that's painful and either gets worse or has at least a waxing and waning course. So if he's kind of gone from a 10 to, let's call him a 7.5, an 8, and he's just sort of sat there for the last 6 months, less supportive of that. There is a condition in dogs called degenerative myelopathy. That just means degeneration of the spinal cord. It's usually slow in onset, slowly progressive, usually not painful. Certainly would be the first French Bulldog I've ever seen with that condition. I usually see it in boxers and German Shepherds and things like that. So needs to be on our list, but it's not super duper high on it. So there are a couple different ways that we can approach this. Approach number one is do tests to see if we can see one of those things, slip disc, meningitis, tumor malformation, etc. Because each one of those we treat a little differently. Each one of those has a different likelihood of getting better. So, you know, and because I can't look at them and say, gosh, 80% chance I think it's going to be this or that, it's reasonable to do tests to start crossing things off our list. So on the one hand, doing tests to find out what we're dealing with, and by knowing what we're dealing with, we'll better be able to say what we can do, what we can't do, etc. Just because he doesn't fit perfectly, you know, when I flip his feet over, he replaces them, there's even a chance that we don't find anything on the MRI, which would be great news. It'd be frustrating news, you know, to do a bunch of tests, but quite frankly, finding nothing is better than finding a slipped disc, is better than finding a tumor, is better than finding meningitis, malformation, etc.
It's gonna be okay. It's gonna be okay. Oh. He's like, Mom.
Can I have you, Davey?
Good boy. Bye, French. You're gonna
Love
be fine.
you.
There you go.
Take a little nap.
Normal. So if there was a problem in the front legs, we would have expected it to be somewhere up here between his head and his front legs. So we expect it to be somewhere from where his front legs ended to where his back legs began. And if we look here, we can get a sense that there's a nice gray spinal cord here, and then it starts to get bright right through there. So I'm gonna zoom in on that. So the spinal cord can only react in a certain number of ways. So a bright spot by itself, you know, doesn't necessarily tell me, is it a stroke or is it a bruise or is it a tumor? So we kind of look at other things. I don't see any evidence of a mass tumor or anything like that. Again, there's no evidence of a slipped disc. If we think of them as a loaf of bread and we make slices of that bread, that's what this picture is here. So this is his spinal cord here. That is kind of the slice right there. And this is really normal, so nice white line around it, nice and round. And as we scroll back, and for what it's worth, his left side seems a little worse to me.
Yeah.
I mean, when he did that in the room, it was his back left leg. We'll start to see brightness on the inside of the spinal cord. So if you kind of come here, it looks normal. As we start getting into this, it starts off on the left side a little bit more than the right. But eventually, I mean, like right here, it's the entire spinal cord that's bright. And then after we get back through it, it kind of goes back to normal. So, you know, the $1 million question is, what is causing this to be bright? And I don't see any evidence of there being a tumor. We look at the MRI in other ways that kind of make tumors more accentuated, and I don't see that. Technically speaking, the only way I can truly diagnose or rule out a tumor is to biopsy the spinal cord, which just we don't routinely do. Just it can make them worse. So the next thing that can cause a bright spinal cord would be something like a stroke. I don't think this is a stroke. Usually that comes on suddenly. You know, you go from a 10 to a 2, whereas he's kind of gone from a 10 to a 9 to an 8, and then just kind of simmered there.
Yeah.
Degenerative myelopathy doesn't look like this. A slip disc doesn't look like this. So meningitis can look like this. We did a spinal tap and there's no evidence of meningitis.
Okay.
So there is a condition, a malformation that I see primarily in kind of older squish-faced breeds like pugs, Boston Terriers, and occasionally in French Bulldogs, is what's called a subarachnoid diverticulum. And basically what that means is the fluid pocket out here, the fluid space that surrounds the spinal cord kind of becomes a pocket or expands. And this picture here makes me wonder, is this an early on subarachnoid diverticulum? It's not the classic appearance, so nothing that Frankie's done so far has been classic for me to say, you know, it's definitely fits perfectly into that box. But what I am most suspicious of is a subarachnoid diverticulum, just based off of the MRI, the bright spot, his age, his breed, his symptoms, and kind of all of the other stuff that I'm much more confident in saying it's not. We're kind of left with that. What's the treatment for a subarachnoid diverticulum? Typically I recommend surgery, but I don't recommend surgery in Frankie's case for a couple reasons. One, it's not a classic appearance of a subarachnoid diverticulum, so it's not, you know, like the thousands of other ones that we see. One. Two, his symptoms are relatively mild, so this is something that in theory surgery could make worse, and you know, the other dogs that I see with that condition, it's part of my conversation with pet owners is, hey, I can make your dog worse, and he's really mildly affected, so the likelihood of, you know, harming is low, but the likelihood of helping is a little lower too, so it's not, you know, shifted in our favor. The last reason is usually when I'm doing this surgery, I like to see like this big pocket here, where these are relatively, you know, small, so I don't know how much surgery would actually help since there isn't a lot of. So what can we be doing and what should we be doing at this point? I think it's reasonable to try a course of medications and see if it helps. If it helps, great. If it doesn't, you know, we haven't lost anything by trying medicine. The medicine that I'm going to prescribe is a drug called prednisone. Prednisone is a steroid. It kind of it's like getting a cortisone injection. It's going to non-specifically take away swelling and inflammation. So it helps with lots of things. It has side effects. Dogs drink more, they pee more, they pant more, their appetite increases when we put them on steroids. Rarely we can get stomach upset. So if you notice vomiting, diarrhea, black tarry stool, we want to know about that because we're going to stop things right away. So increased thirst, increased appetite, panting, you know, I expect that. So really, you're just going to need to probably fill the bowl more. You're going to need to take them out, you know, a couple extra times per day, and certainly right before bed. And then you might also notice more panting. I'll want to see him back in about 7 to 10 days just to see how he's doing on the medicine.
Okay.
Someone's going to call you tomorrow to check in. Someone will call you in, you know, we'll see him back in about 7 to 10 days.
Okay, so we don't know for sure how long he's gonna have to be on this medicine, right?
We're gonna do a relatively short course. It's gonna be 5 days of 2 times per day, so morning and night,
Okay.
and 5 days of 1 time per day, and then every other day. So I'm gonna see him back kind of when we're in the middle, and based on how he's doing, we'll decide, do we keep decreasing it or do we stay at a higher dose? It all
Okay.
depends on how he's doing.
Okay.
Alrighty?
Alright, thank you so much.
You got it. We'll talk to you tomorrow.
Alright.
Oh, thank you. He gave me his ball by himself. You're so cute. Say bye. Bye.
Trying to do that, so I don't know.
Bye.